The motion is agreed to.
Democrats claimed victory last week when they secured the 60 Senate votes they needed to advance the debate on health care reform. But as that debate gets underway, Democrats find themselves still facing plenty of hurdles as they try to deliver President Barack Obama a win on his top domestic priority. A victory rests in the hands of just a few key players, chief among them Senate Majority Leader Harry Reid. It's Reid's job to craft a bill that can get the support of 60 senators. Given the Democrats' majority in the Senate, that should be an easy task, right? Think again. At least 3 centrist Democrats, Louisiana Senator Mary Landrieu, Nebraska's Ben Nelson, and Arkansas's Blanche Lincoln, have made it clear that the bill needs big changes before they'll be willing to support it.
I will not vote in favor of the proposal that has been introduced by Leader Reid as it is written.
Democrats are also watching Joe Lieberman. The independent senator caucuses with their party, but he says if there's a public option in the final bill, he'll be voting against it. Same goes for Maine's 2 Republican senators, Olympia Snowe and Susan Collins. Democrats haven't given up hope that one of them might vote for the bill, giving it bipartisan credibility. But they're with Lieberman when it comes to the public option. If it's in, they're out.
This procedural vote tomorrow presents a serious obstacle if you have substantial concerns about the legislation, as the process going forward will likely require a threshold of 60 votes to add, change, or remove any major provision, including a public option plan.
Of course, the biggest player of them all is the president. He's been making phone calls and holding meetings with Democratic senators. But Republicans will be watching to see if Obama's influence will be enough to get a health care bill on his desk by his self-imposed end-of-the-year deadline.
While it's still possible to meet that deadline, there's little margin for error. Senate Democrats think they can pass their bill by Christmas. But even if that happens, lawmakers have to go through the arduous process of smoothing out the differences between the House and Senate versions of the bill. Julie Pace, The Associated Press, the White House.